Hey guys, just wanted to chat over some signs and symptoms of SIBO or small intestinal bacterial overgrowth. It's covered under like the umbrella term of IBS, so some of the symptoms are very similar, but it is in fact its own unique condition with differentiating symptoms. So it can present like abdominal pain, lots of bloating, like constantly, which can look like bloating that worsens over the day or bloating soon after eating within 2 hours ish, or even bloating after drinking water. It just depends on where your bacteria are, what type of bacteria. This can also lead to extra gassiness, a lot of nausea, constipation, or diarrhea, again, depending on what type of bacteria you have overgrown. Stomach pains, or like just a lot of discomfort in that area. Food reactions is a big one, especially not being able to tolerate garlic, onion, legumes, which is a big one for a lot of people, or potentially gluten and dairy, depending. Can also get a lot of gas. Appetite changes as well. Some people get a feeling of fullness, so they may not want to eat all the time. And occasionally some people do also get like burping and reflux with this too, but generally not as much as the bloating. This can also trigger weight gain changes or weight loss changes depending on where that appetite goes and like what your body's response to that inflammation is. And potentially also mood changes, fatigue, or other inflammation signs around the body. Generally, this is happening because that small intestine is somewhere where it's supposed to not have a lot of bacteria, or there's a specific environment, and something along the lines like your pH changes in the digestive tract, you're not digesting your food properly, stress, anything that's going to lead to leaky gut or intestinal hyperpermeability can weaken that preventative barrier and put you more at risk of SIBO overgrowth. Same with if you were taking antibiotics or had food poisoning or a parasite infection recently as well, all big risk factors. But essentially, we could be looking at overgrowth of gut microbiome that's supposed to be in the large intestine into the small intestine, which creates all of these problems. This is not to say that if you have these symptoms, it's definitely SIBO. There's a lot of other things that it could be. You could, in fact, just have dysbiosis in the lower gut, in the lower bowel, where it's normally supposed to be. It's just a bit out of whack. Could have fungal overgrowth, which we would call LIFO or SIFO now, so small intestinal fungal overgrowth. There are a number of other things, but those are the main ones regarding SIBO. So what you'd want to do is go get tested. There's a breath test that you do to confirm SIBO. And then you and your practitioner, hopefully you're working with someone because it's quite difficult to do on your own. You will work through a SIBO diet plan, which removes a bunch of foods that you can react to in order to essentially starve off those microbiome that are creating the problem. Do that for a bit, maybe use antimicrobials, depends on each practitioner's approach, and then you'll do food reintroductions, and potentially looking at prebiotics, probiotics to help support that gut and re-establish a beneficial microbiome dominance. So yeah, essentially working to restore that environment so it works in your favor in terms of health and long-term digestive comfort. Yeah, if you've got any problems, I work with this all the time. I see a lot of it in my clinic. Pretty much covered it all. So if you've got any questions, let me know, or come see me.